All right. So yes, anticipatory guidance and safety is like my favorite thing. It's probably why I wanted to become a doctor and definitely why I wanted to become a pediatrician. So that's why I picked this topic. My objectives for them was to understand the leading causes of death and then knowing how to give anticipatory guidance and giving specific anticipatory guidance for each child and family. So just to start, about 15,000 children die every day around the globe. And in the United States, if you're looking at just children age 14 and younger, there's about 10,000 children that die every year. And then in addition to that, about 9.2 million children visit emergency departments for unintentional injury every year. And then here's your 10 leading causes of death by age group. So you can look through and find your age group. For most of us, unintentional injury is going to be our leading cause of death until you get a little older, and then cancers and heart disease take over. But specifically, we're focusing on this age group because I only talk to children. So unintentional injury is super common. And then when you're less than a year old, congenital anomalies and super prematurity are important too. And then you can see SIDS at number 4, which is what we'll talk about today too. And then here's just another slide showing you the 10 leading causes of death in children and adolescents in the United States. And these are the 4, because I can't deal with malignant neoplasms. These are the 4 that I mostly focus on today. And then we touch on a couple at the end in addition to this. So anticipatory guidance is just counseling families when they're in the office. And the American Academy of Pediatrics says that it's the most important part of all pediatric healthcare. But when they've looked into it, it seems that the average well visit is 10 minutes long, and the average time spent on anticipatory guidance is less than 1 minute. And they have found that parents really do like getting advice about safety and prevention from their child's healthcare provider. When they did surveys and they asked about it, parents tended to say they got information from their spouse and from their moms and mother-in-laws and then their pediatrician. But they've also seen studies that say 94% of parents report not getting the specific information that they want from their pediatrician. And we are taught to go in the room and ask, like, what questions do you have today? But I think a lot of parents tend to answer like they have this rash or they have a runny nose or they've had a fever, and they don't really think about the other stuff that they're worried. So this one research paper that I read recommended specifically saying, what specific concerns do you have about your child's learning or safety or development, to kind of get those specific concerns and then be able to give advice on exactly what the family cares about. And then they've done studies of, does anticipatory guidance actually work? And it's actually really hard to say. It's hard to study because you can't like prove that your baby was sleeping unsafely and now I taught you that how to sleep safely and that baby otherwise would have died. So you can't say that. So it's really hard to study. The studies they have done tend to look at like workflow and how, because a lot of pediatricians say the reason they don't do a lot of anticipatory guidance is there's just not time. So they've tried looking at how we can work it into the visit. And when they've done that, they have shown that the families that do get the anticipatory guidance are satisfied with the information they're getting and they like the visit better. But then when they've tested the parents on the actual knowledge, the groups that did get anticipatory guidance and the groups that didn't, there wasn't really a difference in knowledge base. So we don't really know that it works, but still the American Academy of Pediatrics recommends it. And I would hope that all other pediatricians agree with me that it's like the most important thing that we can do. So we do still recommend doing it, obviously. So now I'm going to go into safe sleep, and I shared this picture of me and Joel in my crib. This crib, now we know, it was like an absolute nightmare. We don't recommend crib bumpers anymore, and you can see like they're tied to the crib, so that's really unsafe. And then like a really hard toy there with that mirror with kind of small parts. And then I know like Joel didn't sleep in my bed, but you don't recommend like bed sharing. But that doll maybe or maybe didn't sleep in the bed, I'm not sure. But we don't recommend like having anything in the bed with the child. So for sudden death, just kind of like background, the umbrella term is sudden unexpected infant death, and that is broken down into explained and unexplained. So explained includes like suffocation, asphyxia, entrapment, infection, ingestions, metabolic diseases, like arrhythmia, cardiac things, and then trauma, either accidental or non-accidental traumas. And then the unexplained sudden infant death is just your SIDS, your sudden infant death syndrome, and then some other causes. So SIDS was previously known as crib death or cot death. And that's important to remember when we're like talking to families, because if families know it as crib death, they might be more afraid of putting their babies in the crib, even though that is where they're the safest. But SIDS is a sudden death that remains unexplained after a thorough exam, including an autopsy and an exam of the death scene and review of the clinical history. And it is the leading cause of death in babies from 1 month to 1 year in the United States. Most often it occurs between 2 and 4 months, and 90% of the time it's before 6 months old. And maternal smoking is actually the biggest risk factor in SIDS deaths. And it's actually mostly when pregnant is the biggest problem. So 25 to 40% of SIDS deaths are related to in utero tobacco exposure, and they think that it just like affects the baby's ability to respond to stimuli. So if they've been exposed in utero. And then secondhand smoke is an additional independent risk factor. So like if mom was smoking while pregnant, once the baby's born, that risk factor stays forever. But if she's continuing to smoke, that's another additional risk factor. And they have found that there's an increased risk of SIDS with an increased amount of smoking. So if we can get mom to cut back even a little bit, that is at least decreasing the risk a little bit. And then in 1994, the American Academy of Pediatrics issued recommendations that babies should sleep on their backs for all sleep times, including naps and bedtimes. And in that time, since then, supine sleeping or sleeping on your back increased from 13% to 72%. And the rates of SIDS declined a lot from that time too. They've since changed the campaign title to Safe to Sleep, and that encompasses all of their safe sleep recommendations, which includes more than just being on their backs. But now that we've changed it from back to sleep, which was kind of catchy and reminded you that they should be on the back, to safe to sleep, we have a new mnemonic, and it's the ABCs of safe sleep, that babies should be alone on their backs in a crib. And so we're going to talk about each one of these things. So alone means without accessories. So no like pillows, toys, blankets, stuffed animals, anything else at all in the crib, just the baby. And the number one cause of sleep-related deaths from age 4 months to 12 months is rolling onto an object. So that's what I try to focus my anticipatory guidance on in clinic, because I think a lot of parents think like, oh, it doesn't matter if I sleep with my baby, I'm never going to roll over on my baby because I'm a good parent, where we know that's not true. Like good parents can roll over on their babies too. But I think it scares those kinds of parents into, if the baby's face just gets pushed up against something soft, whether it's the mom or the blanket or whatever it is, they could just be breathing their own carbon dioxide. So even if they don't suffocate, they're just not getting enough oxygen and they can die that way. And anything soft like that can create that pocket of air for babies to rebreathe. So bed sharing with parents really increases your risk of SIDS, especially in babies younger than 3 months old, and especially when parents are smokers. And the really huge risk is the soft sleep surfaces, so pillows and blankets and other people. And then there's really no evidence that you can reduce your risk of bed sharing by like co-sleeper devices that they advertise. And I'm going to talk more specifically about those in just a bit. The Safe Sleep 7 is currently like all the rage on the mommy blogs. And it actually was created by La Leche League, which is a really awesome organization made up of moms who are trying to encourage other moms to breastfeed. And we have found that like bed sharing does increase your rates of breastfeeding, because breastfeeding at nighttime is like really, really exhausting. And it's a lot easier if the baby can just be in the bed with you. So these moms, they're not necessarily pediatricians or any sort of experts in anything related to babies other than breastfeeding. So they kind of do recommend this at the expense of safe sleep. And so these are the recommendations: that the mom must be a non-smoker, and that is specifically not smoking when pregnant, not smoking now, not just I don't smoke in the bed, but like I don't ever smoke anything anywhere ever. The mom must be sober, and that's from alcohol and any medications. The mom must be breastfeeding, and they say exclusively breastfeeding. The baby needs to be full term and healthy, and the baby should be kept on their back when not breastfeeding, and they shouldn't be swaddled, and then they must use a safe sleep surface. And that's a kind of interesting one, because we know adult beds are not a safe sleep surface for babies. So they don't really define what a safe sleep surface is, but they do mention actually that this La Leche League people, they mention the safe sleep surface should be on the floor, so like a mattress on the ground, and with no other bed sharers. So they do recommend like the mom sleeps with the baby and the dad or partner or whoever else is in the picture sleeps somewhere else. And it is true that if you're gonna bed share, these 7 things are really important. And it also is true that like planned bed sharing and accidentally falling asleep with the baby in the bed is safer than falling asleep with the baby on the couch or in a chair or somewhere you can drop the baby or they can roll off. But still, we don't recommend babies being in beds at all. And then this is where I think their stuff gets like really quite quacky, is they recommend this cuddle curl. And they say if you like if you sleep in a C like that and the baby's there, that's the safe way to sleep and that's how you can be safe. And they go on to say like a baby who is exclusively breastfed, the breast is the center of his world and he's gonna like keep his face right there by the breast. Whereas a baby that has been offered formula or has taken anything from a bottle, the mom's face is the center of the world. So he might like go up to the face. So like, I don't know that that is true at all. And then I also just like really liked this picture because it shows you like the mom is only allowed to keep blankets on her feet. And then I really like the part where it says no pillow and it is like directly on an actual pillow. So I don't know what they were thinking when they wrote that. And then of course the baby has some sort of toy, stuffed animal or blanket or something. So this is really not at all a safe sleep situation. But the one thing that I did learn when I was looking at the La Leche League and their Safe Sleep 7 is they have a book called Sweet Sleep, and they have a whole chapter in there on how to deal with your judgmental pediatrician. And that was really eye-opening to me because I realized I am a very judgmental pediatrician. And I was telling people before, like, you shouldn't put your baby in your bed because that's how babies die. And so now I've kind of like reframed my advice because I think that was pretty harsh. So the AAP does acknowledge that like there is an increased breastfeeding when we do bed share, and it is really, really exhausting for moms to get up every 2 to 3 hours in the beginning to feed their baby overnight. So really what I say now is I ask, where does the baby sleep? And if they say their crib or the bassinet, I say, that's awesome. That's the safest place for a baby to sleep. That must be really exhausting for you when you're trying to breastfeed. If you find yourself really exhausted in the middle of the night when you're trying to feed, it is safer if you're going to nod off for you to be in your own bed and then for you to be holding the baby in some other chair or couch or something like that. So if you find that you've fallen asleep while you're breastfeeding and you wake up and you realize it, just immediately move the baby back to the bed, their own safe crib. And that also remember that pillows and blankets are really the main risk. And so when you have the baby in the bed with you, just making sure there aren't any pillows or blankets, just moving them to the side. And then the longer the baby is in the bed with you, the less safe it is. So just as soon as you notice it, just get up and move the baby back. And I think that's like a little bit of a softer approach that I now take with parents. And then I want to talk about DACA tots. These were initially marketed for bed sharing. They came out of Sweden where they do bed share and do recommend bed sharing. The wording on their website always did say that it's not safe for unsupervised sleep, but then they would have pictures all over their social media like this. And I don't know if you can tell, but that baby all the way on the left has like supplemental oxygen on his face. So he is presumably a premature baby that is like super not safe at all to be sleeping like that. And then the rest of the babies, like you can't even see their faces. So you can tell that these are not for safe sleep at all. And I couldn't find anywhere that a baby died in one of these devices, but as of October 2020, they have totally changed the wording on their website, and they say they are now adopting a more global voice, and until there has been official studies to show that these are safe, they no longer recommend them for sleeping for any babies. These are really, really popular. You've probably seen them around. They're also really expensive. So I just wouldn't really recommend them at all. They are okay if you put the baby in it while you're watching them and you're awake and they're sleeping, that's okay. But they are just really expensive. So I would say it's not worth it. So that was all the alone stuff. Now we've moved on to the B of sleeping on your back. Prone sleeping means sleeping on the belly, and it just decreases oxygenation. So we know that babies who sleep on their bellies are less likely to wake up overnight, and that's why they like sleeping on their bellies. But the ability to arouse from sleep is really important. So if the baby's not getting enough oxygen, you want their brain to wake them up and startle themselves asleep, and babies who are on their bellies are less likely to do that. And prone sleeping or sleeping on your belly is even more dangerous for babies who usually sleep on their backs. So that's another thing I tend to focus on in the exam room. I say, like, Mom, I know you know to leave baby on his back, but just make sure anybody who's taking care of baby knows that. Because what we saw was parents were keeping them on their backs because they were getting the recommendation from the pediatrician, but then grandparents were putting on their bellies because that's what the recommendation used to be. And those babies were dying because they were used to being on their backs. So that's really important, that anyone that's watching baby needs to know that they should always be on their back when they're sleeping. And then once babies can roll over on their own, it's okay to leave them wherever they land if they can roll both ways. And normally they can roll belly to back before they can roll back to belly. So if they've rolled themselves onto their own belly, that's okay, but you still should put them down on their back when you put them in. And also, once they can roll, that's when it's really important to really make sure there's no other bumpers or pillows or toys or anything in the crib with them. And then also, you don't want to swaddle them anymore once they can roll. And then this is a really important picture because I think a lot of parents think that babies, especially spitty babies, should lay on their bellies so they don't aspirate. But this picture shows you that the esophagus, which is the tube to the stomach, is below the trachea, which is the tube to the lungs, when they are on their backs. So if they're on their backs, gravity kind of helps them. If they do spit up, the gravity, it's just not going to carry it into the lungs. And then I also just like this picture because even if you don't understand the anatomy and that's not what you're looking at in the picture, you can see that the baby on his belly like has his face smushed up against that sheet, and it just like looks really unsafe, even if you're not understanding the point of the anatomy. So I really like this picture. And then I just wanted to mention preterm infants too, because we do put our preemie babies in the NICU, we put them on their bellies. And we're also doing that with COVID patients. I don't know if you've heard in the news, and it helps with hypoxia and apnea and events where babies stop breathing altogether. So babies who are born less than 32 weeks, we do actually leave them on their bellies. But the AAP does recommend that NICU staff from the very beginning needs to be endorsing safe sleep, saying this isn't how they'll sleep when they go home. And then if they have less than 1 week until discharge, it's really recommended that they are always on their back so they kind of get used to being on their back and so that their parents get used to seeing them on their backs. And preemies have a 3 to 4 times increased risk of SIDS. So it's really important in this population to make sure we're really doing safe sleep. And then sleep location in a crib. The Consumer Product Safety Commission has federal standards for cribs, bassinets, or play yards, or also known as pack and plays. Those are really the only things they study and prove are safe. And cribs, they say if they're manufactured after 2011, they're going to be safe. They no longer recommend those drop sides, how like our cribs used to be, like the sides really shouldn't move anymore. They have rules about like how wide the slats can be and how far away the slats can be, so like their heads can't get stuck in there. And then the mattress needs to be a firm mattress that's the same size as the crib, so the baby can't fall like into it. And then you lower the mattress as the baby grows instead of having that drop side. If the baby falls asleep anywhere else, you need to move them to a safe sleep surface as soon as possible. That includes car seats or swings or other devices like that. And then having that firm mattress really reduces your risk of rebreathing and suffocation. They say that soft bedding increases the risk of SIDS 5-fold, and then soft bedding and being on the belly increases the risk 21-fold. And then anyone can call anything a sleeper or a napper. And I think we saw that with DocaTots, but they can release like all sorts of products and just call it a sleeper. And that hasn't gone through that like consumer product safety people that say that it's safe. So just know that you can buy any of those things, but it doesn't mean it's safe. It is safe if it's labeled a crib, labeled a bassinet, or a play yard or pack and play. And then some things we can do to protect against SIDS. So room sharing, not bed sharing, but just baby being in the same room with an adult, not a child, is protective. Twins should have their own sleep surfaces as well. Pacifier use actually is protective. And they say like you put the baby to sleep with the pacifier. If it falls out, you shouldn't force it back in. It still has the benefits even if it falls out. And if the baby doesn't want it, don't just like keep shoving it in. It's okay. And then, of course, you don't want the pacifier to be attached to a strap or a cord that they could strangle themselves on, or one of those like stuffed animal pacifiers that is also soft. So just like the one plain boring plastic pacifier. Breastfeeding, especially exclusive breastfeeding, is protective. Not overheating the baby. So they say that you should dress them in one extra layer than what you are comfortable in. So like a onesie and then maybe a long sleeve shirt on top of it, plus the swaddle. Being fully immunized is actually a protective factor. And they did a study that they were trying to show like the increased rate of immunization is leading to increased risk of SIDS. And they just found the opposite. So it tends to be that being fully up to date on vaccinations is protective against SIDS. And then they found that hospitals monitoring appropriate sleep behaviors is really important because parents tend to do what we do, not necessarily what we say. So we always go around to make sure all of the babies are safe sleeping. And if they're not, then we educate the nursing staff. And then if the kids that are like up on the floor, sometimes parents will say like, oh, I don't want them in a crib at home. We sleep together. They have to sign a release form that says like they understand that that's a risk and the hospital won't be like held responsible if something happens. So that was all on safe sleep. That was a lot. And that's like the bulk of it. All of the other sections are a little bit shorter, but does anybody have any questions that you want to talk about safe sleep before we move on to cars?
I have a quick question.
Hit me with it.
I know my friends have this thing that they put on their son every night. It's like a sleep sack. Like after they put the pajamas on, it's like they put it through his arms and it's like a sleep. Are those things safe?
Yeah, that's basically a swaddle. So that's just like an easier way to swaddle because a lot of times it's hard with a blanket.
But he's a toddler. He's like 2-ish or 2. But I think his feet are out. Like I don't think.
Yeah, we normally say not to stop swaddling once they can roll, but if are his arms in?
No, his arm. Oh, that's why I'm putting my arms up. I think it literally
I can't see his arm.
It's like, oh, sorry.
No, I can't. Go ahead.
They make sleeping bags like that for toddlers. So they put their feet out so they can walk in it and they have their arms out too. So they're not swaddled. And it's supposed to be safer than having a blanket wrapped around them. So they say after one, typically you can have a blanket in the crib, but I have seen those too, that they start off with their arms swaddled in and then you can have them that they can walk and have free range. So they do make them up to toddler sizes. That's probably what your friend's using. And that's safe for sleep.
Okay.
Yeah. And really the risk of SIDS is only up to 1 year old. So after one, there's really no more risk of SIDS. They certainly can still suffocate on things, but that sounds like it's fine.
Thank you. This is very informative. That was my question for this section.
Can Southern doctors keep up with your presentation?
I talked a lot slower when I did this in real life.
Good question. I know when you were talking about the DockATot and how it's not labeled as a safe sleep device, but they do say that if your child's asleep and you're awake supervising, it's okay. Do you have any advice on, we have friends that just had a new baby just this past week and every picture they've sent has had the baby sleeping in the DockATot with the face to the side with the blanket. And I've tried very gently kind of being like, hey, you might just want to read up and see if that's safe and everything. So are they really supposed to be safe as long as you're supervising baby and you're right there watching them sleep every moment?
Yeah, if you are standing over the baby and watching them, then you would know if something happened.
Right.
It's just like, are you always standing over the baby and watching them?
Are you never a step away from them? Yeah.
And I have a really hard time with like people I know personally and like posting pictures and stuff. Like, I really don't know how to approach that. It's so different than when you're in the office and you're like, you are the pediatrician. Like, I feel very comfortable giving advice, but I really don't know what to do when it's like someone I know personally on social media. Yeah. I don't know how to be like, hey, that's not safe.
That's not safe. Yeah.
What about like the outlet? What's your opinion? Okay.
Yeah, they actually don't really recommend them. And what they've found, they're not going to hurt anything, but what they found is there's a lot of false positives. So the outlet is like a sock that you can put on the baby and it gets like their heart rate and their pulse ox. And a lot of times it sends it to your phone. But what they found is one, parents have like a false sense of security. So they're like, oh, I put the outlet on, so now I can have the blanket or have them on their belly or leave them wherever and they'll be okay. And two, they tend to like have a lot of false positives, which just like really freaks parents out. So I do see them sometimes in the ED, like they'll come and be like, oh my gosh, my baby's heart rate was 200. And we look and like the baby's fine. And so I think it tends to increase parent anxiety more than anything else. Okay. It's not going to hurt, but it's not
Just
recommended.
be aware that like if I get a weird reading from it, if we're using it or whatever, that we need to check other methods to make sure that that's incorrect.
Right.
Yeah. Okay.
I mean, and I'm always happy to see babies that are well. Like that's one of my favorite visits too, is like we call it a worried well visit, where the parent has a concern and they bring them in and they're like, it's fine. And I'm like, I love visits where I get to just be like, yep, no, baby looks great, like nothing to worry about. So like never ever hesitate to panic about things and call your pediatrician. But it tends
And then also, since you're Miss Medical Doctor, and we're talking about sleep, what's your thought on waking a sleeping baby? Like, I feel like the first 6 weeks, your first at least 2-3 weeks, you need to wake a sleeping baby. And then after that, it's kind of, you don't do it. What do you think with that?
Yeah, it's really until they're back to their birth weight. So babies will lose weight in the beginning because they have some water weight and then they just don't eat as much as you were feeding them when you were eating for them. So they tend to drop off and then they should be back to their birth weight by 2 weeks. And once they are, then it's okay to let them go a little longer overnight. They're still going to wake up they're not going to go more than 4 hours really. But if they do, that's okay.
Okay.
Once they're back to their birth weight. Until then, you do have to wake them up every 2-3 hours.
Yay, guys. You hear that?
That doesn't mean that's how that's going to work out.
Oh, I'm waking this kid up.
It also helps that the baby usually wakes itself up every 2 to 3 hours too.
Their bellies are really, really small, so they get hungry a lot.
Yeah, that was one of the classes we took. I didn't realize this. So like for other parents who are their first time, so when they're a newborn, their stomach is the size of a cherry.
Mhm.
Like it's tiny. So anyway, continue. You're doing
All right, we ready
wonderful.
to move on to
Yes.
car seat safety? All right, awesome. So we're going to talk about car safety for all ages. So car accidents are a leading cause of death from children 5 to older than that, like pretty much the rest of childhood. And they say 1,000 children under 16 die every year in car accidents, and that a child under 13 is involved in a car accident every 33 seconds, and that car seats really reduce the risk of fatal injury by more than 70% in infants and more than 50% in toddlers if you have them buckled in properly. So the AAP actually released new recommendations in 2018 that children should remain in a rear-facing car seat as long as possible until they've outgrown the height and weight requirements. They previously said up until 2 years old. They've completely taken out the age. Now it is just as long as possible. And then once they've outgrown their rear-facing car seat, they should be in a forward-facing 5-point harness for as long as possible. Once they've outgrown that seat, they should be in a belt positioning booster for as long as possible until they can be without the booster and that the seatbelt fits properly, and that's usually until they're 4 feet 9 inches. And then once they've outgrown their booster, they always need to wear their lap and shoulder belts. And then children 12 and under always need to be in the back seat, never in the front seat. And then the AAP also recommends that the pediatrician should discuss this at every single visit. They do think it's like the most important topic to talk about. This isn't really relevant to you, but I found it interesting, and it was relevant when I gave it last time, that the North Carolina law is like way more lenient than the safety recommendation. So they just say that a kid under 4 years old who weighs less than 40 pounds needs to be in the back seat. So like if your 4-year-old weighs more than 40 pounds, which is a lot of 4-year-olds in Eastern North Carolina, they can be in the front seat. If you have a 5-year-old, no matter how much they weigh, they can be in the front seat. If you don't have a back seat in your car, kid can be in the front seat, that's fine. If you do have a front seat, but there's not an airbag, that's fine. Your kid can be in the front seat. Yeah, so like super crazy in North Carolina. And then to keep your kid safe in the car, it's really like 4 steps. You need to buy the correct car seat. You need to like properly install the car seat into the car. And then you need to properly install the child into the car seat. And then you need to like keep up with the car seat maintenance. So we're going to talk about each of these things. These are the different types of car seats that we really just talked about. The important thing to remember is like once you buy a car seat, you don't need to buy any of the other like attachments and things that go into it. So they have those like head positioners, and they have like strap things that like are soft and like I guess presumably more comfortable. But the car seat has been tested without those things, so adding those things only makes it more dangerous. And then you just want to read the label on the car seat and make sure like your child is within the right limits of that car seat. And then you also can register the car seat so that if there's a safety recall or anything like that, you would be notified about it. And then briefly, we're just going to talk about physics, not a lot about math. But 60 to 80% of accidents are front end collisions, and it takes 600 pounds of force to keep a 20-pound child in place that is moving at 30 miles an hour. So that's a lot. If the baby is rear facing, then those forces are more evenly distributed. If they're forward facing, their head is just going to go flying forward. So babies' heads, toddler heads can be 25% of their body weight, and their spines are just not strong or developed enough to hold those giant heads in place. So in an accident, a kid's spine can stretch up to 2 inches with their head flying forward like that. And it only takes like a half an inch or maybe even a quarter inch to cause paralysis. So that's why they really recommend for as long as possible for them to be rear facing. And there's really no known risks of rear facing. A lot of parents get worried that as soon as their kids are touching, their feet are touching the back seat, that then there's a risk of them hurting their legs. I mean, it's possible, but you'd rather hurt your legs than hurt your head and your neck. And it's also just really it's not likely. And kids are just really comfortable with their legs squished up against them. So that's like the most common thing I've seen is parents flip them too soon because their legs are too long, but really toddlers are more comfortable with their legs scrunched up than they are with them dangling. And then here's just a picture of what we just talked about. So the kid on top is forward facing, and when he's hit from the front, like his whole head goes flying forward. The kid on the bottom is rear facing, so he's just like pushed into his seat a little more and it's safer for him. And then when you install a car seat, you can call a certified child passenger safety technician. And when I gave this talk, I have like a list of all of the ones in my town, in my county, but you can just Google like CCPST and your county, and it will tell you where you can find them. A lot of times, like definitely in my town, it's the hospital, the sheriff's department, the health department, the fire departments. So most of the time, those places around you have child safety technicians, and they can help you put the car in the car seat. But you want to look at your car manual and find the best place to put in the car seat. Not every car has, like, not every seat in every car can fit a car seat. So just read your car manual and make sure that whatever seat you pick is safe for them. And then you either use like a latch system or the seatbelt system. And again, it depends on your car and the car seat that you buy. And once it's in, you shouldn't be able to move it more than 1 inch in any direction. And that's how you know that it's in there safely. And then when you put your kid into the car, you just want to make sure that the armpit, that the chest clip is at armpit level and that it passes the pinch test. So if you try to like grab the straps anywhere, you shouldn't be able to pinch any between your fingers. And if you can, then you just want to tighten it. And then it's also important to remove winter clothes or like kind of bulkier items before you buckle them. So that this little girl in this picture is showing you like she has a puffy winter jacket on and she's buckled in tight. But if you were to take that winter jacket off, see how much slack that she has there. And I just also really love this picture because doesn't her face look like she's looking at you like you're so stupid for buckling her in wrong? Like, look how mad she is at all that slack that she has in her car seat. But you just want to take this seat off because if the coat off, if you are in an accident, the kid can actually like slip out of the coat and fly out like as if they weren't wearing any protection at all. And then just remember that every time you move your kid to the next stage of car seat, they are a little bit less safe. So like parents look at things as milestones, but really like as long as possible that you can leave your kid in the car seat that they're in, the safer it is. And then also if you are in an accident and car seats do expire, if it does expire, you need to get a different car seat. And then just wearing the seat belt, you want to transition. It's going to be between 8 and 12 years is when they outgrow their booster seat. And you would know that they are ready to be without the booster seat and just in the seat belt if the lap belt goes right across their hips and not across the stomach, and that the shoulder belt goes across their chest and shoulder, not across their neck or their face. And of course, the shoulder strap always belongs like in front of them, not under their arm or behind their back. We tell parents that they can pick their battles, but this is one that you want to pick. You really should either tell your kids like the car doesn't turn on if your seatbelt isn't buckled, the car can't move if your seatbelt isn't buckled. No matter how long the ride is, wherever you're going, you've gone 100 times, they should be buckled every single time. And then they do strongly recommend too that the parents model that behavior. And they've said like drivers who drive with their seatbelt on with kids in the back, the kids in the back are more likely to buckle. So this is just one of those non-negotiable things. Seatbelts need to be on all the time. I tell, like, starting at 5 or 6 years old, I ask the kid directly, do you wear your seatbelt in the car every single time? And to like teenagers and stuff, I'll tell them, like, statistically, if you're going to die, it's going to be in a car accident, and wearing a seatbelt is the safest way to keep you safe. And then switching to the front seat. So always 12 and under need to be in the back seat at all times. You never want to be in the front before age 13. And really the back seat is the safest for everyone. So like next time you're driving with someone, like if you're not the driver, you really are safest in the back seat. When they designed airbags, they tested them on 140-pound men that were wearing seatbelts. So they're really not designed to protect anyone else. So even tall kids still have immature bones. So that's something we see a lot, is like, oh, my kid's tall so they can sit in the front, but they still are not fully developed. When the airbag comes out at like 80 to 120 miles an hour, it can damage their sternum, it can hurt their heads and faces and necks and pelvis. So it's really, until 13, always in the back seat. And then they do say, like, what if you have more kids than you have back seats? And like, truly the pure recommendation is that you should then have another driver. Like, you should never be putting a kid in the front seat if like there are too many kids. But like for our hypothetical situation, like let's say you have a kid at every stage of development. So you have like an infant that's rear facing, you have a toddler that's in a forward facing 5-point harness, you have a school age kid that's in a booster, and then you have, let's say, like the tall 11-year-old who just wears a lap belt. The actual safest person to pull, and then if you only have 3 seats in the back, the safest one to pull to the front is actually the toddler in the 5-point harness. And you just want to turn the airbag off because the airbag will still be really dangerous. But that toddler that's in a 5-point harness car seat is actually safer than your like tall 11-year-old in the front seat. And then the National Highway Traffic Safety Administration just like wanted to remind you that like cars are really dangerous even if they're not moving. So you can like leave your kid in the car and they can have heat stroke. Your car could accidentally back over a kid. Kids can get stuck in power windows. They can get stuck in seat belts. They can get stuck at the trunk. They could be in the car and the car could just like roll away and be off a cliff. So like the take home point is you should never ever leave your child in or around a car by themselves at any point. That is the thing to remember. And this is one of my attending's kids, and you can see like how long her legs are, and she is still rear facing, and she is very happy to have her feet like scrunched up, and look how cute and southern she is with her little boots and her big bow. She's so cute. But that is her demonstrating how happy she is to have her feet scrunched and not have them dangling. Does anybody have any questions about car seats or car safety at all?
A question about a car seat. So someone told us that they recommended, you know, since we don't really separate much anymore, you could buy one car seat, but you can buy 2 bases and then just like switch it. Do you recommend that, or should like we each have our own for our own car?
So the infant seat, a lot of times like has a base that stays in your car, and then you can carry the carrier. So then it would be really easy to just have like 2 bases in your car. And I would recommend that if like you can afford it, and that is probably the easiest for you because then you don't have to take off that base every time.
All right, cool. That's easy.
What about, this is kind of like going with both of your sections. So obviously like kids are going to fall asleep in the car. So, and that's not ideal, but ideal at the same time, whatever. So what is your recommendation for, we're driving somewhere, like we're on a road trip, baby falls asleep in the car, do we wake them up?
You don't have to wake them up. They have, like when you install the infant seat, there's like a, like kind of like a level thing that shows you, like I don't really know how to describe it, but you know that you are at the correct angle it is approved for. So if it's at the correct angle, the baby will be safe in there. It's not ideal. So once you get to your destination, you want to move them to a flat sleep surface. That's another thing, like, oh, that kills a lot of babies, is really tragic, is like they fall asleep in the car, the parents take the infant carrier and just set it somewhere because now the baby's asleep, and then that's really dangerous because if it's not in the carrier, like in the car thing that keeps it in that correct angle, then it's not safe. So it's okay to let them sleep when they're in the car, but if the car seat's not in the car, they shouldn't be asleep in it.
Got it. Okay.
Good question.
Thank you.
All right, I think we talk about swim safety next. So this is a quote that I actually read well before med school. I think I was in high school or college, and like some celebrity's child drowned and died. And they had said in the like People magazine article that I read, like my pediatrician never told me that drowning was a leading cause of death. And I remember being like, oh my gosh, I never want to be the pediatrician that forgets to mention this. And actually, I've read like a bunch of mommy blogs when I was preparing for this talk. And that is like a really common thing that parents whose children die from drowning say, like, just really don't realize how serious and how common drowning is. So drowning is actually the leading cause of death for kids age 1 to 4. So sleep before age 1, car accidents after 5, but between 1 and 4, drowning is the #1 cause of death for kids in the United States. They say 3 kids die every year due to drowning. Most often it's in a home swimming pool, but in the like teenage group, it's more common in natural waters. And then 70% of the time it happens during a time that's not swim time. So I think most parents know like that water is dangerous. So when they are at the pool and they are swimming, they're always watching and paying close attention. But most commonly, it's like the toddler that wanders off and falls into the pool when nobody's paying attention. So no child should ever be alone near water at any time. Your home, if you have a pool at your house, it should have a 4-sided fence that is 4 feet tall and has a self-latching gate. And that is like the #1 thing that protects against unintentional drownings, is having this 4-sided fence. Most commonly, there's not a 4-sided fence in home pool situations. You've probably seen like it's a 3-sided fence with the house being like the 4th side. And if that's the situation, then anything that opens, any part of the house that opens to the pool needs an alarm. So the door, the window, the dog door, like needs to have an alarm. So if someone were to go out, you would know. During swim time, the adult should always be within an arm's reach, and that needs to be a sober adult who's not distracted and not on their phone. Should just be, they call it like touch supervision, that you should be able to grab the kid out if you need to. They do recommend avoiding floaties like other flotation devices. I'm going to talk more about that. And then swim lessons in children over a year old are effective at preventing drownings. This is another thing to talk to kids about and just be like, the rule is, if you're getting in the water, you ask an adult if it's okay first, so that they're never like wandering off. So like just a hard and fast rule for our family is if you're ever near water, you say, is it okay if I get in, before you get in? And that is helpful for like toddlers or young children to learn, like they can't just be in the pool without anyone knowing. So briefly, boating in open water, they recommend like that you only swim in the ocean if there's a lifeguard, that you should always enter the water feet first for the first time until you know how deep and safe it is. Both adults and children should wear life jackets when they're out on boats. You should never be near water alone, no matter how old you are. You always want to avoid alcohol and other substances when you are around water, and you really shouldn't ever swim in moving water. And then, so when you're on a boat, and all swimmers need life jackets, they recommend getting a life jacket that's approved by the US Coast Guard. And if you just look at the label, that will tell you that. But they really don't recommend puddle jumpers, which is what this little guy is wearing, and other like non-approved flotation device. And that's for 2 different reasons. One is it gives the kid a false sense of security. Like that little kid doesn't realize, like, the reason I'm not sinking to the bottom is because I have this on. So he's a kid that's more likely to kind of wander into the water when he's not wearing it and not realize that he's not going to be safe. And the other thing is that it holds him up in that like vertical position, which is not a rescue position, and it's not how he's going to eventually learn to swim. So when he does fall, he doesn't think to like turn his body and get himself to float. He is like, his mind, his muscle memory is telling him he should be upright in the water, and that's just going to make things worse. So they really don't recommend puddle jumpers. They say like kids shouldn't be in any sort of floaty device. You should just always be holding them if they can't stand in the pool. And they do recommend swim lessons, not before 1 year of age. Like you've seen infants kind of have that swim reflex, but they're not able to save themselves no matter how smart they are until at least a year old. They just don't have like the body, the muscle memory, or like the mind to do it. So mommy and me like swim classes just to like get acquainted with the water before a year old is fine, but you're not going to just really truly start swim lessons. But between the ages of 1 and 4, you should focus on water survival skills, and you should be with a trained instructor who is qualified in CPR and is always within the arm's reach doing that touch supervision. And then they recommend that the water needs to be warm and clean because babies are going to like swallow a lot more water than we do. It needs to be chlorinated correctly. So you want to do like an approved swim lesson, not just like some random guy that you invite to your house. And this is actually one of my acquaintances, and her kids do swim lessons. The son is like just barely 2 and the daughter was just barely 1 in these pictures. And they did swim lessons in like normal swim clothes for the majority of the time. But their like final exam was that they kind of pushed them in the water when they were wearing their clothes. And I just think this is a good like visual reminder of like, this is how it would happen, is like your kid that falls in when they're not ready to go swimming. They might be wearing jeans, they might be wearing sneakers, and they should be able to save themselves. So they really just teach them to like get their faces up and out of the water so that they can breathe, and then either call for help or swim to the safety. And that's all on swimming. Any questions about swimming?
That's so cool. What about those, like I have seen friends that post pictures of their babies with those like little donut things where their head is like popping out just to kind of like have them float.
It's
You know
not
what I'm
going to
talking
help them swim.
Yes, but well, I mean, I don't know if I don't know what the purpose is. I don't know if it's to get them like comfortable with the water, but it helps keep their head out of water.
Yeah, I mean, really, like if your baby's in the water, you should just be in the water holding them.
Yeah, I've seen it like in a bathtub. I feel like.
I know what you're talking about. I'm not sure that it, like, surely it's been tested and it's safe. I haven't like specifically read about it, but it
This is
doesn't
very
count as a safe flotation device.
Yes.
Question for you, Dane, on toddlers. So I know the pedal jumper isn't recommended, but is it recommended to have a Coast Guard approved life jacket, or is it really better to have them wear nothing at all and basically just hold them and let them kind of kick and splash around?
It's really best to just hold them when you're in the pool.
Okay.
Because really the fear is that they're gonna think that they can float. And they
Right.
they
And
just
then they'll
won't
think they can
realize
go in
that
without anything.
Right. And that was
Okay.
a lot of the stories I read of kids dying, was that they always used the puddle jumper and they didn't realize that they were going to sink if they went in without it.
Gotcha.
All right, next is gun safety, which is a huge thing in Eastern North Carolina. I at this point, I don't even ask, like, do you have a gun in your home? I just like start giving my gun anticipatory guidance. I just assume everyone has a gun in their home. In 2019, there were 241 unintended shootings by children that resulted in 100 deaths and 150 injuries. That is a top 3 cause of death for kids in America, and like kids in the United States are 36 times more likely to die by gunshots than youth in other high-income countries. I don't think that's super surprising. A gun in the home is 43 times more likely to kill a family or friend than a burglar or a criminal. I think we know these things. So the AAP has a pretty like specific policy statement that says the most effective way to prevent unintentional gun injuries, suicides, and homicides to children and adolescents is the absence of guns in homes and communities. So that is their official recommendation, that you should not have a gun in the home. But again, like my patient population, the majority do. So they do go on to say like how we can be a little bit safer about it. You should have an unloaded gun that's stored in a locked area, and then your ammunition needs to be stored in a separate locked area. And then no children or adolescents should have the keys or combination to the safe where the guns are. Guns should never be in the car because that's just way too accessible. You can get trigger locks and like fit your guns with high pressure triggers so that like small children won't physically be able to pull the trigger, and that might reduce injury a little bit, but it's still not safe. And then they've really found that gun safety classes are not helpful at avoiding unintentional injury, and it may actually increase gun handling in children and especially adolescents, but that just talking to kids about avoiding guns is helpful. So this is one of the things I do, like role play in the office. Like I ask kids, 5, 6, 7-year-olds, what would you do if you're at a friend's house and you see a gun? Is it a toy? Can you play with it? Is it okay to pick it up? Those kinds of things. And then my spiel for like gun storage to parents, again, I don't even ask if there's a gun in the home. I just say any guns need to be locked, stored away, not just high up. I think a lot of parents think like it's okay if something's high out of reach, but toddlers are way smarter than we are and they can get anywhere. So it actually physically needs to be locked somewhere. And then adolescents who have access to guns are much more likely to successfully kill themselves. So I just put that in my adolescent thing, like any access to guns is a huge risk for any teenager. So we recommend having them locked away where the adolescent doesn't know where they are. Any questions on gun safety? We went through that one quickly. Next, we have bicycle safety. So there are about 1,000 deaths per year from bicycles, and that includes 600 children. And then in addition to that, there's nearly 500,000 bicycle-related injuries. Most of the time, it's just like a musculoskeletal injury, but about a third of them can be head injuries. To reduce your risk of injury, you want to wear a bicycle helmet all the time. It's also one of those things like seatbelts. It's just non-negotiable. If you're riding something that moves outside, you need to have a helmet on. They recommend wearing fluorescent clothing even in the daytime, and really kids shouldn't ride at night at all. You need to have the correct bike size. And so that should be, kids should be able to sit on the seat and the balls of their feet should be able to touch on both sides. Children's bikes should have the pedal, like the bikes that the brake is pedaling backwards instead of the handbrakes, so they just don't have the muscle coordination to be able to use handbrakes. And then they really shouldn't be riding in traffic at all. But if you are in traffic with a child, they need to ride with traffic, not against traffic. And they should use the hand signals. So some people think like we don't want our kid taking their hands off of the handles to signal. But if they're going to ride in traffic, they need to be letting other cars know where they're going. So they need to use the hand signals. And then bike helmets, it needs to be a bicycle helmet, not a football helmet. And it needs to be worn the entire time, every ride, the whole time, even if you're on a bike path or you're in your driveway or on your sidewalk, you need to wear it all the time. Just like a car seat, if you're in an accident, you need a new helmet. And if you get a haircut and now your hairstyle is different and your helmet doesn't fit right, you need a new helmet. And then you do recommend storing them inside, not in a hot or cold garage where like the plastic can warp. And then I included this video of my very first two-wheel ride ever, since I had given the picture of my unsafe sleep environment. Here I am modeling appropriate helmet behavior. So I told everyone this was during medical school. So this is Campbell University's tennis courts where I learned how to ride a two-wheeler for my first time. And then trampolines. These are a really common cause of injury. Thousands of people are injured every year. Children under 6 are at the highest risk. Most commonly, again, is musculoskeletal injuries, but concussions and neck injuries are really common too. Most of the time, it's when you fall off the trampoline or you land on springs or you bump into another person or you're attempting stunts that you're not going to be able to do. So the AAP has another like very specific statement on their feelings on trampolines, and it is that you should not have a trampoline in your home. And they go on to say, if you do, essentially, like it shouldn't be a fun one. So you really should only have one jumper at a time. And we all know like the most fun thing about trampolines is when you get double bounced by another jumper. You really shouldn't do flips. There should be adult supervision at all times. There needs to be netting and protection over the springs that need to be in good condition and checked often. And then they do specifically state that if you have a trampoline in your house, you need to make sure your homeowner's insurance policy covers trampoline injuries, because that's how dangerous they think trampolines are. And then I looked into trampoline parks because I just thought it was interesting. They're like increasing a lot. And they've shown like ED visits have increased by a ton since they've become popular. There's really no federal regulations on them. There's just like voluntary regulation standards. So there's no like true safety standard for them. The really dangerous thing is there's no way to regulate the size of the bouncers. You can't keep like teenagers and even adult bouncers away from the little kids. And so just that mismatch is really easy for little ones to get hurt. And then a lot of times the staff is just like high school teenagers and they're not trained in any sort of first aid. So once bad things happen, you just have to wait for 911 to get there. And that can be really dangerous in itself. Food safety, we're going through these things quickly now. We're in the home stretch. These are your major choking hazard foods: hot dogs, whole grapes, popcorn, nuts and seeds, chunks of peanut butter, ground cinnamon, hard or sticky candy. Really anything round and hard should be avoided. The AAP actually says up until 4 years old. And I actually just yesterday saw a picture on Facebook of a 5-year-old that had swallowed a whole grape and it was stuck. And luckily it got out in time, but even 5, it's still pretty young to be eating a whole grape. So they really recommend cutting them into quarters, and same with hot dogs, like cutting long ways all the way to quarters. When I was in the PICU this past year, I admitted a kid who choked on a peanut. And what's really really dangerous about peanuts is they have like all those oils in them that then just like leak into your lungs, and you can be really sick for a really long time. And the surgeon that was on with me that night taught me that kids shouldn't eat peanuts until they can legally eat them at a bar with a beer. So he says until 21, the AAP says 4 years old, but I like that because I'll always remember it. And then medication safety. This is a really common thing we admit little toddlers for, is taking medicines. So you want to keep medications locked away. You want to keep them in their original containers, and you want to keep track of how many pills were in that container. So you know, like if they get into it, you'll be able to say like exactly how much the kid took. You want the child lock caps to stay on them. If you're done with a medicine and you're not going to use it, take it back to the pharmacy. Don't just throw it away. And then knowing the poison control hotline. This is a really common question that we ask like med students that come through. Every PEDS resident has it memorized. The poison control hotline is 1-800-222-1222. So they are the kindest people. I call them all the time to talk to them. And they just like tell you exactly what to do. So they're awesome. And then I just wanted to touch on amber teething necklaces, another thing that is like all the rage on the mommy blogs these days. They say that they can, when they are warmed by the baby's body temperature, the amber releases pain relieving substance that is absorbed through the skin into the bloodstream, and it promotes it stimulates the thyroid gland to control drooling. It promotes calm, and it improves the ability of the immune system to reduce inflammation in the ears, throat, stomach, and respiratory systems. There is no science that proves any of these things. And they are a choking hazard. You can choke on the beads, or you could just like strangle on the necklace. So we really don't recommend them at all. Some parents love them. So we say you can wear them only on the wrist or on the ankle, not around your neck. And only when you're awake and being watched by an adult is it okay to have them on. We also really don't recommend teething gels, and that's just because babies can swallow them, and like the teething gels are really numbing gels. If they're swallowed, then you are numbing your whole like throat, and then you don't have a gag reflex, and you can choke on your own spit, and that's just not good. So I recommend just a damp washcloth that's free, because most people have washcloths. They sell all those really expensive teething toys. My families aren't able to afford those things, so just a wet washcloth in the refrigerator, and then give it to the kid. They can gnaw on it, and they're really happy with just that. So again, this was more geared towards the pediatricians I gave this talk to, but like a reality check of how we as pediatricians are doing. When they've asked parents, less than 55% of them remember hearing anything about supine sleep position at their last well check, and less than 20% of parents report hearing anything about where the sleep location is. 25% of parents have their kids forward facing in the car seat before they are 12 months old. So that's way too young. 2 million kids live in a home with an unlocked and loaded gun, and 42% of children wear their helmets every time they're riding a bike. So we still have a lot of room for improvement. Most of the information I got for this talk was on healthychildren.org, which is the AAP's website that is written for parents, not for pediatricians. So I love that website. It has everything organized by age. So you can just like click like, I have a toddler, what are the things I need to be looking out for? And then it's also organized by like section. So like, what do I need to know about car seats? What do I need to know about safe sleep? Those things. So I really love healthychildren.org, and I read pretty much their entire website for this talk. And I think that's it. So anybody have any other questions?
I've got a question.
Yeah.
So I've got a couple of colleagues with 6-month, 8-month-olds, maybe one even a little older, and I'm curious about aside from peanuts, what your take is on foods, like introducing foods. It seems like at least these friends are like in a completely new school of thought where you let them try anything and everything. And I just wondered what your thoughts were on that.
Yeah, there's a new thing called infant-led weaning, and it's just like letting the baby eat whatever they want. Of course, with the exception of those like choke hazard foods. So that's really what I tell families, like you just need to avoid the things that they can choke on. We don't avoid peanut products anymore. So like the puffs, like basically Bomba, they sell now in America. And we do recommend that, or like peanut powder. It's just not peanuts or peanut butter because that's way too sticky, but you do want to expose them to peanuts. You want to expose them to eggs early. And they've found like kids that get to choose from a plate in front of them and can like play with the textures and put it in them without like you freaking out about them being all messy and you being the only one feeding them, that they do really well. So I follow like a dietitian on Instagram, and she did with her twins, she did 100 foods before age 1.
Foods before age 1. So what happens if they stop eating after they're 2 and they only eat 2 things?
White things and
I don't know what to do with adults.
I was going to ask, yes, because I think the reason why I eat the way I do is because my mom sat there and said everything was gross. So I feel like it's a lot of mind over matter. Like if you introduce it, like I feel like I'm finally starting to come to terms with like someone asked me if I eat blueberries and I was like, no, I don't like them. And I'm like, I've literally never had a blueberry. I can't even say that. So like Dave laughs at me. So I feel like a lot of it is how you, I mean, and with teaching too, is about how you approach things. Would you agree with that?
Yeah, so I have specific advice for picky eating. I know it's funny because I'm the pickiest eater, but I do tell, like, you have to introduce the same food over and over again. They say up to 15 times for kids to be comfortable with the texture and the flavors. Something that they loved yesterday, they might hate today. That's okay. Give it again tomorrow. See what they'll do. Again, 15 times it can take. So they have to try it 15 times before they're allowed to say they don't like it. Kids are picky. I tell parents, like, you pick what they eat, they pick how much they eat. Kids really won't starve, like they will eventually eat. That kids should really eat what you're eating. You shouldn't be making like kid-friendly foods for them. But you should make something that you know they will eat. So like if you're serving chicken that day, having a side of mac and cheese so they can have a little bit of that, and at least you know they're gonna get something.
So pretty much what you're saying is that you would not have starved.
I don't think I would have. Well, maybe I would have, because
what
really
should we have done?
Because her
Really,
mother
yeah.
made extra stuff that she would eat.
So what should we have done when you were 3 and
She just said what
fighting?
we should have done.
I probably would have been hungry, but I always would have eaten cereal in the morning. Like, I don't know. I think I'm a special circumstance.
I mean, we do have the Gordon stubbornness, so I feel like that's a whole nother level. But so then, okay, I know that a lot of people are saying introduce one thing at a time and then go gradually, especially, so like we have a history of nut allergies on his side of the family. So if you already have that history, is that something you want to be a little bit more cognizant of, or just kind of let them go through? And I know too, like with eggs, you're supposed to introduce it during the week when the doctor's open, if there's an emergency type thing. Like what, do you have a different type of advice?
Yeah, it's not a bad idea to just have access to emergency care in the event that you need it. Originally, they used to say like you should only do one food every 3 days. So like if there is a reaction, you would know what it was to. They're not like entirely sure that that is totally scientifically sound anymore. But I mean, one new food a day, I think is fair. Like they would react before. Like if they reacted today, you aren't going to be like, oh, is this what they ate yesterday? And be like, oh, it's what I just gave them.
And then for nursing, is there any sort of connection of like they react poorly to something that you eat? Like I'll use Katie as an example. So like Grace Katie had to completely cut out all dairy for Grace when she was nursing. And now Katie doesn't have it. I don't think Grace is eating it. If I'm correct, I could be wrong. Is that something that it's different from when you're nursing to when they start eating the food, or is it more likely to carry over?
Kids tend to outgrow food allergies at like 5 years old. A lot of them do. So milk protein is a really common allergy. And so that's why a lot of moms do have to cut out dairy, but around 5, they should be able to pick it up again and be okay. And a lot of times it's like my stomach gets upset, not like I go into anaphylactic shock and I'm going to die.
Madeline, do you know what Bamba is? It's it looks just like a cheese curl, but it's peanut based, like it's peanut butter based, and it's an Israeli thing that started there. And they found that because all kids eat Bamba in Israel, that their peanut allergies were so much less. I mean, a fraction of the rest of the world, because these kids are being exposed at a very young age to this little cheese puff kind of a thing. So it's really exposing the kid and giving them a chance to learn to fight it off. And so it's the opposite of what you'd think, trying to protect them and not letting them have anything. is just the opposite. You really kind of want to know if they're allergic and giving them little bits of it to let their bodies build the immunity for it.
Yeah, even when I started med school, the recommendation was like no peanut products before age 2. So that's like within the last 5 to 10 years that they've changed that recommendation. You guys are a great audience.
This was a wonderful presentation.
Yeah,
Great
terrifying,
work. Great
but
work.
I was gonna say, Joel and Gina, you look scared shitless sometimes.
Yeah, those numbers were scary, very scary to me. I'm glad we don't have a pool, trampoline. We're not doing anything.
Car, you don't have to
Guns.
drive in the car anywhere.
Yeah, I'm gonna stay
Yeah,
right,
right.
here. You all just come here. That's as far as we're gonna go.
What about bounce houses when it's time?
When they're like,
I think they're probably just as dangerous as trampoline parks, I would guess.
So maybe
don't need that
only
crap.
for your high school graduation, get them.
Right.
And then have your grandmother go in and bounce with you. Yeah, right.
Yeah, hear that over there, Grandma Sue?
Okay,
You
I-
can't
Great
protect them from
job.
everything. They gotta have fun too. So it's just trying to find that balance.
Yeah, this was extremely
fun.
informative, even as not
Yeah.
a parent yet, but I'm glad I attended.
Yes,
Me too.
thank you.
We'll still
Thank
be
you.
comparing with
Thank you,
you.
Dana.
And you can still call her for advice when you need to.
Absolutely.
Yeah, expect all the texts still.
Mm.
But I
Happy
did
to
take a
answer
picture
text.
of that healthy, the website. I'll go there first and then I'll call you.
There was some scary stuff there. I mean, I guess pediatricians are ready for it more than us common folk.
Just seeing the numbers to the things, I had no idea. That was like,
I
oh
didn't
my
realize
God.
how common drowning is. And we serve the whole eastern part of the state, which includes the beach, obviously. So we like daily we get drownings.
Right.
in
You can
the
also
summertime.
drown. You can also drown in the bathtub.
Yeah.
Absolutely, yeah.
Yeah, you
So
can drown in like an inch of water. It's crazy.
anywhere. Yeah, if the baby's face is covered, they can drown. So we do see bathtub, but it for us most commonly is this at the beach. Those are most of the kids that we admit, but
Well, it's just also very interesting, the whole I like those swimmies. I always thought those are great, the ones that you showed, because I feel like but it makes a lot of sense that you don't want them to give them like false like understanding that no, if someone's not holding you, you're going to sink. So it makes a lot of sense.
Well, no, so I used to teach swim lessons. And so the hardest thing for me, because you want to teach them how to like turn on their back and put their head back really quick. And that's actually a very uncomfortable position to turn them to do. And they fight you. And so you have to tell them to relax and you have to tell them like, oh, look, is there an airplane or is there a shooting star? Whatever you can do to get them to really put their head back. And then they're much more relaxed. And that was the other thing. My dad was the waterfront director of a Jewish summer camp up in Missouri. And my sister and I were literally the only people who were never allowed to wear floaties for that reason. And so I'm like looking at the presentation, like, yes. But I mean, truly, like you have to, so that's a thing for you guys too. Like, since you didn't teach swim lessons, you really want them to get them to put their head back. And then it's so much easier for them to float than to just tread the way that we think that that's how it would go. And I never thought of throwing a kid in the pool or making them in the pool with their clothes on. That was brilliant. So I really liked that too.
I would have thought the kid would sink from the weight of the clothes.
well, that's why you need to
Alone.
practice with them.
Yeah.
I mean, do you tell them to kick their shoes off in that situation, or do you want them to keep them on?
It looked like they were keeping them on and floating with them. So I think they're able to.
It's crazy.
It's just saving their lives. You're just teaching them to survive. That's all that is. Well, Dana told us that one of the kids in the ICU, NICU, was from a lake, was it? The kid wandered
It was
off?
like a little creek, like she lived on a farm. And I don't know if it was like a body of water or just like a puddle that had formed. And it was a really sad story because it was like playing with cousins, like 12 and 13-year-old cousins, and they were running around. And at one point, the parents were like, why are the 2 older kids in here? Where's the toddler? And she was just like out face down in the creek.
What about, I haven't heard of it in a while. It's like delayed drowning.
Yeah, we don't really believe in that.
That's what I thought too, but some people are very scared of that. And that never made sense to me.
Yeah, I don't truly understand like the physiology of what they are talking about. I've never seen anything like that before. It's
Does
like
the
the
current
dry
guidance-
drowning when they drown like 48 hours later. I don't know anything about that. Or I
Does the
do know
current-
that we don't really believe in it. I don't understand why people do. Like, I'm not sure what the argument is.
Does the current guidance still say no sunscreen under the age of 6 months old?
It's really like no direct sunlight under 6 months old. So if you're gonna have them in the sun, you should put it on and then like wipe it off when you're not in the sun. But it's just like, it's not tested and approved under 6 months old.
What's the point of
Okay.
that? What's the issue?
Their skin is just really permeable and it's not tested in under 6 months old.
So you
And they would
should
just
take,
recommend
to
doing
the
like
beach
long
or-
sleeve
Right,
rash
Right, doing
guards
long sleeve and like
instead.
a hat or whatever, and just staying out of direct sunlight, like not being like staying in the shade, or certainly not going out from like noon to 4 or whenever the high sun is. I don't know. I don't go outside, but
What about
Vitamin
kids' vitamin D,
D.
Dana?
you just put them on medicine.
That's actually good. I don't know for those that are expecting their first, if you've met with pediatricians or whatnot, but if you have a breastfed baby, you're actually supposed to give them vitamin D drops. Is that something you recommend too, Dana?
Yeah.
That it's like a little tiny like bottle. You can either put it on your finger and the baby licks it off, or you put it directly on your breast and they get it while you're nursing. But that was something like the first like couple of weeks of my daughter's life that like we had never heard of. And then we like went to our pediatrician and we're like, why weren't we told about this? But they're sold on Amazon and in most like drugstores, but they're just supposed to
Yeah.
help them because they lack vitamin D from the breast milk.
Actually, formula too doesn't have enough in it
Oh, okay.
until they're taking 1 liter of formula per day, then they're not getting
Oh,
enough
wow.
vitamin D, which is a ton. So yep, I do. We have samples that I give parents in their first visit, and then I just tell them to buy like a big thing at Walmart and it will last you for a long time. It's just 1 drop a day. And I say the same thing, put it on the bottle nipple or put it on your nipple. So it's just the first thing they get.
I was gonna ask, like, when in the feeding is it best to do, before, after, or whatever?
It doesn't really matter. It just, you don't want to forget it. And I just tell parents not to like mix it in the bottle, because then you have to make sure they drink the whole bottle to get it. So that's why I tell parents to just do it on the nipple.
Give it to the husbands. That's their job, is they've got to make sure that the vitamin D is on the nipple.
That would help them.
Oh, you're
I call them
recording this
worthless
still, right,
man
Uncle
nipples.
Mike?
Yeah,
You're
right.
recording.
I'm just telling you how men can get involved and be happy and keep things going.
Still
Give
recording.
those
We're all adults here.
You said do that just once a day, like
Mhm.
1 drop.
Just bottom line, just keep the little human alive.
That's right.
You make it sound really difficult though.
I tell people like no like crowded areas for 2 months until they've gotten their 2-month vaccines. And I would say that doesn't change. Like for a walk in the park, that's going to be fine. Or just like sitting outside is okay. Or like out beach is okay if you're not around a whole bunch of people and you're outside. And that's kind of the same for, I wouldn't think that would change much with COVID.
I was surprised to learn too that like you have to kind of wait like a week or so after their 2-month vaccines to be effective too. Like if you only have 3 months of maternity leave and you're like, all right, we can finally take her outside. And they're like, well, you should really wait a week or so after the 2 months. I'm like, all right, so now we have 2 weeks that we can take her places.
And what about those jumpy things that used to hang in the door frame and stuff like that? Anything about them?
I think I see Ange unmuting herself. Go ahead, Ange. Ange is a pediatric physical therapist.
Yeah, I work at CHOP. So besides the fact that they aren't actually really great, like kids don't need to be jumping under the age of 2, especially on trampolines, because they don't really have the best bone development for it. But anything that kind of contains the way that the baby sits can interfere with their motor development. So it's really interesting. We've been getting a ton of referrals for gross motor delay of babies between like 8 months and 18 months right now, because parents are just trying to figure out how to work from home and also have their child at home with them. So they stick them in things all day. And most of the seats keep them with like the rounded back, like the bumbo floor sitters and extra saucers and everything like that. So they don't actually get the abdominal engagement of how to sit up. And also baby walkers are kind of dangerous because besides the fact that they also kind of encourage toe walking, which is also something we've been seeing a ton of lately. They don't allow them to basically use their own core muscles to sit up their body. So they're actually not getting the upright development. So even though this seems insane, we usually recommend that babies spend only up to 15 minutes a day in containing devices like that, which like you have to feed yourself and like take a shower and go to the bathroom. So that's not actually possible, but just as little time as possible to allow them to kind of like learn to hold their own head up, hold their own body up, develop their protective responses. So they put their arm out to the side when they fall, everything like that.
So then I have a question with that. Like a lot of the carriers that you have that like are connected to you, do you have a preference on better than worse? Because a lot of them are saying like you want as much skin to skin with that baby as you possibly can get, but that could also kind of mess up their core and stuff, couldn't it?
That's a little bit different because that's more of a like carrying thing. Like just like when you're carrying a baby, you don't really worry about how you're supporting them, except that you should support them. But it's more when they're like learning how to do their developmental skills. So like if they're a little bit late to sit, putting them in a floor sitter. So because a lot of times babies get frustrated when they're like, especially if they have older siblings and everyone's like running around and the baby doesn't know how to sit up yet. But it's actually better to sit them like in the middle of a boppy where they have to like sit themselves up. It's kind of like that. So carrying them, unless you're like literally carrying them 12 hours a day and never putting them down and they never get their tummy time and everything, it's not a problem.
Hey, Doc, thanks. It was informative.
Thanks
Thanks,
for coming,
Dana.
everyone.
Very nice.
Nice practice,
you.
because I have to give it
Great
again
to
next
see
week.
everybody.
Thank you. Thanks, Dana.
Thank
It
you
was
so
great.
much, Dr. Dana.
Text me anytime.
All right.
You got it.
Bye,
Bye,
guys.
y'all.
Take
Happy
care.
Thanksgiving.
Bye, everyone.
Bye.
Everybody.